Dusty, and to those who organized this, and shout out to Fred, who I know so many in this room have come to know and work with and respect for many years. And I will say, when you think of the medical community, the multidisciplinary teams that are involved in managing our illness, I think they're extra special because we know that the disease has carried such a stigma. And so the doctors, the nurses, the medical professionals who chose researching and helping to treat and manage patients signals to me that they're quite extraordinary, because they are entering a field that didn't have the same kind of support and funding that we are all collectively working to change with our advocacy and research work. So Fred, thank you. A special thank you for being a part of our community in this way. Terrific first panel. So much important information shared. I don't want to be redundant, but what I could tell you is that November is always such a reflective month for us all, because we look at, gosh, what have we done? What haven't we done? Where have we succeeded? Where are there still challenges? And where do we need to go? And I can tell you that when I think back as to how our organization chose to focus in particular ways, having been founded by a handful of survivors almost 20 years ago, what we knew we needed to do was get our stories out and help shape public perceptions, as well as help our medical community. And so that meant trying to put all of you who are here as patients and survivors and caregivers front and center, making sure you are seen, you are visible, your stories are heard, and using that as a mechanism to try to engage multiple billions of dollars that needed to flow to research. So that's why we focused on the policy work that wasn't being done around this disease in its entirety. There had always been such great work done in prevention, but we knew early detection and treatment were the two legs of the three-legged stool that needed as equal attention. And thus, we began setting out legislative priorities that simply stated lung cancer needs to be viewed in a coordinated, comprehensive, and compassionate way with a better federal plan of action. And because of all of you and your willingness to come forward and engage and be advocates, we have seen tremendous progress, and in fact are really poised to use that foundation to launch what is, in essence, the next decade, the next generation of achievement around research funding and better shaping our healthcare delivery system and making sure our public health infrastructure is set up to be providing best practice and responsible care. So all of this takes collective effort. We may have ideas and strategies, but without all of you sharing your stories, talking about how this is impacting you and what your needs are or your experiences, we will never continue to achieve what we know we can. So every one of you needs to step back and say, wow, I guess we really have come a long way. We have a dedicated lung cancer research pipeline that hopefully this year, and again with your work, we could have over $20 million, $120 million secured that is being pushed out to the research community, which is then encouraging researchers to enter the field because they know that there will be resources and opportunities now to look more strategically at this disease research space. We have been able to educate members of Congress and their staff who then look at what types of programs What types of initiatives within all of the various federal agencies need to be engaged? We have caucuses now that allow us to hold information meetings where, again, all of you can be a part of sharing your story and talking about what you need and why. We have been able to look at reimbursement and coverage. We're involved in how healthcare delivery systems need to be adapted and shaped. We're looking at expediting the way in which drugs are approved so that they can get to patients quicker and better and without complications. And most importantly, looking at where are there barriers to access? How can we, again, through your experiences, share what really needs to change and happen? That's advocacy. But advocacy is really about how all of you engage and share. And it can be in many ways and doing many things. But this is the one way in which Lung Cancer Alliance, among other programmatic work, has felt it could fill a needed gap. And that's think through strategically how every one of us plays a role in shaping what we know could result in billions more dollars and a better healthcare delivery system.